This is our change agent project. So for our scenario, we had integrating electronic health records, or EHRs, in a hospital setting. In a large hospital, nursing leadership and management are facing a scenario that necessitates a change in practice regarding the integration of electronic health records. The hospital recently adopted a new EHR system with the aim of improving patient care, streamlining workflows, and enhancing data accessibility. However, several challenges have arisen. Many of them are user resistance. For example, many nurses and healthcare staff are resistant to the new EHR system due to its complexity and the learning curve associated with it. Some of the issues are interoperability issues. The new EHR system does not seamlessly integrate with other hospital systems, leading to data silos and inefficiencies in patient care coordination.
So to summarize that, the goal of adopting the EHR was to improve patient care, simplify the workflow, and improve the data accessibility. However, there have been many challenges that came up when we tried to implement something like this, and that included user resistance, interoperability issues, workflow disruption, and patient safety concerns.
One major potential area for improvement is the complexity of the EHR system. In an article called Usability Challenges in the Electronic Health Records, an Impact on Documentation Burden and Clinical Workflow, it states, the critical need for improved EHR design that minimizes workflow disruptions associated with documentation burden. Addressing these challenges requires human factors approach that streamlines information retrieval, optimizes interface usability, and eliminates unnecessary task complexity. With the presentation of a new EHR, many nurses find the new technology difficult to navigate with confusing documentation pathways. When a system is not user-friendly, it increases cognitive load and documentation time, pulling nurses away from direct patient care. Simplifying workflows within the EHR and reducing unnecessary steps would significantly improve usability and efficiency. Another potential area for improvement involves interoperability. The EHR does not seamlessly integrate with other systems such as pharmacy, laboratory, radiology, and billing. This creates data silos, delays communication, and can lead to incomplete clinical information at the point of care. This can cause a lot of miscommunication and errors. Effective interoperability is essential for coordinated, safe, and timely patient care. The EHR is not fully aligned with bedside nursing workflow. When documentation systems do not mirror clinical workflow, inefficiencies increase and frustration builds. Workflow mapping and bedside nurse input are important to correct this gap. A final potential issue is the lack of transparent communication during implementation. Many staff members were unclear about the purpose, expected outcomes, and long-term benefits of the EHR system. Without clear communication and shared vision, resistance to the change increases.
One of the most significant actual issues is user resistance. Many nurses felt excluded from the decision-making and implementation process of the new EHR. When frontline staff are not involved early on, they might feel that change is being forced rather than developed collaboratively. Increasing nurse involvement would improve buy-in and ownership of the system. Training and competency development also require improvement. Some nurses received limited hands-on instruction and lacked confidence using advanced features of the EHR. Without structured education, staff may rely on inefficient habits or develop unsafe ways to get around the chart. Ongoing education and competency validation are essential for safe practice. Poor documentation can increase patient safety risks. Incomplete clinical information, delayed lab results, or medication reconciliation errors can also lead to adverse events. Manual workarounds such as shadow charting increase liability and documentation errors. Protecting patient safety must remain the central focus of system optimization. In an article called Implementation and Delivery of Electronic Health Records Training Programs for Nurses Working in Inpatient Settings, it reviewed 30 different peer-reviewed articles. These articles discussed healthcare systems' approaches to implementing and delivering the EHR training programs and how they varied. They observed themes and innovations such as the ability to practice EHR skills after training is over, personalized training, and training pace. They also looked at the inner setting of the hospitals, such as the availability of computers, and if there were clear documentation requirements and expectations, as well as individuals and their as well as individuals and their computer literacy and their learning preferences. Finally, they looked at the implementation process, for example, trainers and support staff holding nursing backgrounds, establishing a process for dissemination of the EHR updates. Overall, they found that there are a multitude of factors that go into the process of adjusting to a new EHR system, and additional studies are needed to focus on the best retraining programs.
Okay, so to successfully improve the EHR, it's going to require collaboration among multiple different people and positions. So this includes the chief nursing officer, nurse managers, bedside nurses, physicians, IT specialists, clinical informatics experts, the quality improvement team, executive leadership, and EHR vendor representatives. Frontline nurses like us are the most important when implementing this change, especially when getting feedback, because they interact with the system the most and can provide practical insights into the improvement of the system. So in an article called The Use of Big Data Analytics in Healthcare, it talks about how medical facilities now rely on diverse data sources, including what they called unstructured content and sensors, which requires input from all of these different people and all of these different roles. So since decisions are increasingly data-driven, the practical insights from frontline nurses are essential for making sense of that data. And it talks about how healthcare is moving towards a system where technical tools and human experience have to work together. So these people are going to be really important in doing that.
To improve the identified issues with the new EHR system, a structured and collaborative action plan should be implemented. A clinical decision support system can aid in the improvement of implementation. In an article called An Overview of Clinical Decision Support Systems, Benefits, Risks, and Strategies for Success, it states, a clinical decision support system is intended to improve healthcare delivery by enhancing medical decisions with targeted clinical knowledge, patient information, and other health information. A traditional CDSS is comprised of software designed to be direct aid to clinical decision making, in which the characteristics of an individual patient are matched to a computerized clinical knowledge base, and patient-specific assessments or recommendations are then presented to the clinician for a decision. Having an action plan and CDSS, it can ensure that improvements are effective and sustainable while maintaining a strong focus on patient safety and quality care. Other parts of this action plan include surveying the nursing staff regarding usability barriers, workflow mapping to improve efficiency, weekly meetings to discuss and evaluate feedback and prioritize improvements, tiered training starting with beginner, and there's intermediate and advanced, integrate pharmacy, lab, and radiology, pilot testing before the first launch, and monitoring outcomes, which could be documentation time, med error rates, and the nurse and patient satisfaction scores. And this leads us directly to Lewin's change theory.
As Cherish said, Lewin's change theory can be applied to guide this process, which consists of 3 phases: unfreeze, change, and refreeze. This framework helps organizations prepare for change, implement improvements, and sustain new practices over time. Using this structured approach increases the likelihood of long-term success. In the unfreeze phase, leadership must assess readiness for change and address resistance. This includes conducting anonymous usability surveys, performing workflow mapping, and rounding regularly to communicate the why behind the EHR system. Leaders should clearly connect the system to improved patient safety and quality outcomes. Identifying super users and providing mentorship also builds confidence during this phase. During the change phase, hands-on simulation training and paid protected education time should be provided. A tiered training model, beginner, intermediate, advanced, ensures all nurses build competency at their level. Collaboration with IT should focus on improving integration across pharmacy, lab, and radiology systems. Pilot testing improvements before hospital-wide rollout reduces risk and allows for refinement. Monthly optimization meetings encourage continuous feedback and adaptation. In the refreeze phase, the goal is sustainability. Leadership should monitor key performance indicators such as documentation time per patient, medication error rates, nurse satisfaction, and patient satisfaction scores. Annual competency validation and quarterly system reviews reinforce that accountability. Recognizing high-performing units and offering continuing education credits encourages long-term engagement and professional growth.
So if this is implemented correctly and effectively, the action plan is supposed to increase nurse satisfaction, reduce documentation burden, improve interdisciplinary communication, enhance patient safety, and then also it's going to create the stronger collaboration between nursing and IT, which is going to create a culture of continuous improvement. So in an article called Facilitating Ambulatory Electronic Health Record System Implementation, which is where they did a qualitative study and took evidence from it, they look at how doctors' offices successfully switched to digital filing systems. And basically, they talked to the people who implemented these systems in the offices, and they did talk about, yes, there were all of these challenges, and there was technical glitches, and the staff didn't like it, and there was a lot of resistance, but they were able to successfully implement it and have increased nurse satisfaction and reduced documentation burden and better patient safety and all these things at the end of the day, because they had such constant and consistent communication and collaboration. So it ended up being really successful for them, and it did do all these things. And ultimately, the EHR's main purpose should be a tool that supports and helps nurses, not one that's going to make patient-centered care harder and make their work lives even more difficult than they already are.
In conclusion, integrating a new EHR system presents both challenges and opportunities. While complexity, resistance, and interoperability issues have created these barriers, structured leadership strategies and collaborative change management can transform these obstacles into growth opportunities. By involving frontline nurses, improving training, enhancing system integration, and applying Lewin's change theory, the hospital can achieve sustainable improvement and deliver safer, more efficient patient care. These 5 research articles touch base on usability issues, successful implementation strategies, clinical decision support systems, interoperability, and successful EHR training. And that's our presentation. Thank you.